Good afternoon. Thank you for joining us. I'm Nick Abu-Asli, Mayor of the City of Marion. I want to begin by thanking all the leaders across our region for the great collaboration and coordination that has taken place so far in our collective response to this crisis. We've had good communication and information sharing between emergency management, the cities, the county, healthcare community, and public health officials, nonprofits, economic development entities, businesses, and residents of our region. Ultimately, our success as a region in addressing the challenges we face from this unprecedented event will be defined by how well we are able to unite and work collectively with a common purpose. We have many heroes in this war on COVID-19, and they all deserve our gratitude and thanks. Today, we'd like to pay special tribute to the heroes who work in long-term care facilities. From the beginning of this crisis, much of the discussion and planning has been related to surges of cases and workload in hospitals. But we know now that a real surge has hit Linn County's long-term care facilities. All workers who are caring and providing for the needs of the virus's most vulnerable victims are frontline workers who deserve our sincere gratitude and thanks. They are the ones who are providing direct care and giving hugs and comfort to our most isolated older family members and friends. All people working in long-term care facilities are just as exposed as other frontline workers. And personally, I spent some time over the past week calling directors of long-term care facilities and senior living communities, checking in with them to express my appreciation and support and let them know that they have not been forgotten. I've communicated with friends who work in care facilities to understand their situation and gauge their needs. We can all do something to show them that they are valued. If you know people engaged in caring for older adults, please take the time to reach out to them and express your appreciation and support. Yesterday, Governor Reynolds stated that COVID-19 is part of our lives now, and we must learn to live with it. So while the priority at this time remains mitigation and slowing the spread, we should also be thinking and planning for life after the surge and living with the virus in our community. So to that end, late last week, the City of Marion announced the formation of a recovery task force that will include representatives from government, business and economic development, health, human services, and faith communities. The task force will begin to proactively identify needs and devise solutions and recommendations for decision makers. And as I stated, while we're not out of the woods yet, and the primary focus is still mitigation, we want to, at the same time, be proactive and prepared for what things will look like when we can eventually return to normal activities. I want to close by thanking all the residents of our region for staying informed and engaged, listening to the guidance from public health officials, and doing their part to slow the spread and help our region through this crisis. Thank you.
Good afternoon. I want to start today by echoing the sentiments shared by Mayor Abu-Asli. Our healthcare providers of all stripes, including those who work in our long-term care facilities and group homes, are heroes, not just in times of crisis, but every single day. I also want to recognize Linn County Public Health. It is impossible for me to communicate how hard these individuals work to keep us all safe. They spend countless hours on contact tracing, data analysis, planning and logistics, and answering hundreds of questions from businesses, governments, and individuals. They are champions for the most vulnerable, and they are not thanked enough. And I also want to give a special shout out to Mary Charper, who was a teacher at McKinley Middle School when I was there, and she made me some nice face masks to wear, so I appreciate that. A few weeks ago, Governor Reynolds unveiled a scoring matrix that she is using to evaluate the mitigation strategies that could be deployed across the state. We were told that once a region reaches a score of 10, that she would consider shelter in place. Well, we've reached a score of 10, and that happened exactly 1 week ago. The governor decided not to delegate the shelter-in-place authority to local governments and instead chose to reemphasize the need for individuals to practice social distancing. And we've said all along, while there is no magic bullet that will solve the problems we are facing, it will take a combination of efforts. Now, it appears that the governor is moving to a strategy of mass testing, which certainly has its benefits. But I'm here today to communicate that even if our numbers of confirmed cases increase as a result of this testing, our score on her matrix could very well stay the same. We would have no way to indicate, by her standards, that we are in greater need of services or resources. You may recall that the governor laid out 4 metrics by which to observe counties and regions. Number 1, the percent of population greater than 65 years of age. Number 2, the percent of identified cases requiring hospitalization. Number 3, the rate of confirmed cases per 100,000 population in the past 14 days. And finally, number 4, the number of long-term care facility outbreaks. You may also recall that the governor assigned a maximum score of 3 for all of these categories. As of today, Linn County is at an 11, and the only way this number could increase is if we have more outbreaks at long-term care facilities, keeping in mind the governor's definition of long-term care facility outbreak does not include workers at these facilities, only clients. Doesn't matter if our confirmed cases increases, doesn't matter if the number of deaths increase. All that matters, according to her matrix, is whether we have more outbreaks at long-term care facilities. It is my hope that Governor Reynolds will reconsider these metrics and take under advisement more than just 4 data points, as this pandemic is shaping up to be one of the greatest challenges of our time. Now, you've all heard the numbers, so now I want you to see the trends. We want you to turn this data into understanding, and then turn understanding into action. So I'll reference one chart for you here. So on this chart, you'll see the number of confirmed COVID-19 cases by date. And over here on the x-axis, we find March 20th. And around about that time, we had 4 confirmed cases of COVID-19 in Linn County. And as you move, you see the number of confirmed cases continues to rise. 30 days from our starting point, we have over 500 confirmed cases of COVID-19 in Linn County. This green line represents the number of individuals who have recovered from COVID-19, which we are really happy to see. And this last line here represents the number of deaths attributed to COVID-19. Ultimately, it is our hope to push all of these lines on this graph downward. As you can see, we have not yet hit the apex, and we're still trending upward. We must be diligent and increase our efforts to meet this challenge. I do want to thank all of you for your efforts to date. I know this has not been easy, but imagine how much worse this could have been without your sacrifices. Even though we have all worked hard, we have not yet flattened the curve. We need you to be extra careful as a community and not become complacent as the weather improves. Now, one final point I'd like to make before I conclude is that COVID-19 is clearly impacting us all. There is no generational divide with this virus. The next chart I'll reference clearly shows that while the death rate may be higher for people 60 and older, younger people are not immune to the severities of this disease. And I'll move to show this final graph. So on this final chart, we can see Linn County confirmed cases by age group. And as I mentioned in my remarks, we see that the largest category of confirmed cases are for individuals between the ages of 18 and 40. And from there, the categories of confirmed cases decreases here by age. So the largest category between the ages of 18 and 40, the second largest category between the ages of 41 and 60. Next, between the ages of 61 and 80, and finally, the ages of 80 and over. So you can see here again, as I've mentioned, this virus does not discriminate by age, and that's important for us to keep in mind. In closing, I keep coming back to the mantra that hard things are hard. I cannot recall a more complex and far-reaching crisis in my lifetime. But here we are, facing this thing together. And if there is a silver lining to be found, let it be that this crisis once again reminds us that we're all in this together, and we all have a shared stake. We share this space, this community, this entire state with one another. And since a virus can infect each and every one of us with no regard for our skin color, our religion, our age, it doesn't matter what side of town you live on, who your parents are, or whether or not you root for the Hawks on Saturday. We're in this together. And if we do what is hard, what is necessary, we'll get through this together. Thank you.
Good afternoon. My name is Heather Meador, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. As of 1 p.m. today, there are currently 507 cases of COVID-19 in Linn County. We have 33 deaths. Fortunately, 241 individuals have recovered. Today, the governor announced a third outbreak at a long-term care facility. Manor Care Health Services in Cedar Rapids is also experiencing an outbreak. At Manor Care, 10 residents and staff members have tested positive for COVID-19. There are no deaths associated with this outbreak. We also continue to follow up with 2 other outbreaks at Linn County long-term care facilities. At Heritage Specialty Care, 110 staff and residents have tested positive. Unfortunately, 22 of those residents have died. 72 staff and residents have recovered from this illness. At Linn Manor, 22 staff members and residents have tested positive for COVID-19, and 5 residents have died. Linn County Public Health continues to be in daily communication with all of these facilities. In addition to working with our long-term care facilities, Linn County Public Health is currently providing assistance to reduce the spread of COVID-19 within multiple congregate living homes and facilities. Vulnerable populations reside in these settings and require a number of people to care for them. We are working with the Iowa Association of Community Providers in regards to group homes within Linn County. We want to stress the importance of restricting the number of individuals, staff, family, friends, or others that are entering long-term care facilities and group homes. Every interaction that you have is a potential exposure to COVID-19. We know that many people have questions about the governor's Test Iowa initiative that Supervisor Walker mentioned earlier. We want you to know that Linn County Public Health was not involved in the planning or implementation of Test Iowa, and we learned about the new testing option during governor's press conference. We have fielded many inquiries as the Test Iowa assessment indicates that some Linn County residents should have a COVID-19 test, but there is currently no way for them to register. Our message continues to be to encourage all Iowans to not wait for Test Iowa if they are experiencing symptoms of illness. Please contact your healthcare provider. If you have questions regarding Test Iowa, please visit the Test Iowa website or contact the governor's office at 515-281-5211. This week, we added additional information to our Linn County, Iowa Coronavirus Response webpage. This page is to provide the community the most accurate and up-to-date information on COVID-19 in Linn County. We would like to thank Linn County GIS Department and our community partners, such as the Marion Police Department, for their tireless effort and help to make this website possible. New information added to this webpage includes a map of confirmed cases by zip code, a graph of confirmed cases by date, confirmed cases by race, and also confirmed cases by ethnicity. The website has the ability to translate the information into multiple languages. This new capability allows the community to understand the impact of COVID-19 within Linn County. We are using this information to reach populations that may be unequally impacted by COVID-19. This includes providing additional outreach materials to impacted communities. Public health professionals are servants to the public. Protecting the health and safety of Linn County is our primary concern. We are passionate and dedicated to the work we do. Although we may be silent partners that you do not know, we make sure that the air you breathe, the water you drink, the food you eat are safe. We live by our mission statement, which is to prevent disease and injuries, promote healthy living, protect the environment, and to ensure public health preparedness. We have been serving our community before COVID-19, we will serve you during COVID-19, and we will continue to serve you after COVID-19. Thank you.
This is the end of the prepared remarks for today. Dr. Dustin Arnold from Unity Point Health is also available for questions in addition to the speakers that you just heard. For the media attending remotely, please indicate to the moderator if you would like to be entered into the queue. And as a reminder to our speakers, please repeat the question before responding. I do have one question that came in to us prior to the press conference that I will ask, and then we will move to the questions on the line. This question is from Ashley Neighbor at KWWL. Her question is, for employees concerned about their health due to workplace not taking proper or adequate precautions, what should they do? Is there a resource or place they can reach out to? She says, if OSHA is the correct outlet, are there Iowa resources for immediate concerns? And I'm going to ask Heather Meador to answer this question.
Ashley, that's a great question, and we're always concerned about all workers within Iowa. If you have any concerns about your workplace not following safety measures to help protect you, we encourage you to contact Iowa OSHA at their complaint line, and that phone number is 515-725-5660. Thank you for that question.
We do have a question from the line. It looks like this question is for Stacy Walker from Travis Breeze at KWWL. Travis, go ahead.
Hi, Stacy. So my question is about what you're saying about asking the governor to perhaps re-examine the way that she measures an outbreak at long-term care facilities, and you're talking about even if we were to see increased cases in the county, that you may not be ramped up on the governor's scale. Are you bringing this up because, would you like to see more stricter guidelines in place, like for Linn County residents as far as going out in public? Is that one of your reasons for pushing for this?
Travis, thank you for the question. And for those who were unable to hear the question, Travis is asking about essentially why it is I brought up the fact that the governor's metrics that she has outlined for observing counties and regions, why I've brought that to the attention of our viewers today. And the reason is simple. The governor has found 4 metrics to measure one of the most complex and far-reaching crises of our time. And right now, across the board on the categories, for most of the metrics, Linn County has reached the max, which are 3 points allowed. And as I mentioned earlier, the only way our numbers can increase on her matrix is if we have more outbreaks at long-term care facilities. And while we certainly hope that doesn't happen, it does not take into account the number of deaths we may have, or if hospitalization rates continue to increase, or obviously if the number of confirmed cases of COVID-19 continues to increase. So I'm struggling personally to figure out how capping these numbers makes a whole lot of sense and allows us any insight into the severity of the problem in a county. I am encouraging the governor to revisit these metrics, and I'm encouraging the governor to continue to work with local county public health agencies so that we can get a complete understanding of what the reality is and the situation is on the ground, and not just judge our counties and our regions by 4 simple metrics.
Okay, thank you for that, Stacy. I also have a question for Heather. I'm going to proceed with it unless somebody asks me to stop. Heather, I believe I heard you talking about a partnership to address housing needs. I couldn't quite hear exactly what you were talking about, but let me know if you were talking about this question. But something that popped into my head was these long-term care facilities. I doubt they would be, taking new residents or new clients at this time. And I was wondering if in Linn County, or if you've possibly been a part of any conversations statewide, if there are people who are, displaced right now who need, the care of someone else looking over them, and if that's perhaps, something that you're hoping to address in Linn County, or if you have any solutions for that.
So thank you, Travis. So Travis is asking about if long-term care facilities are still accepting patients. And so when looking at long-term care facilities, you are looking at a group of individuals that are very dedicated to the welfare, the health and safety of our older Iowans. And so they are a tremendous asset to any community. And we are very fortunate within Linn County to have multiple long-term care facilities to step up to the plate. So the health department, in conjunction with other partners, we are monitoring the long-term care facilities within our county. Each day they're filling out different surveys for us, and we're looking at what their needs are to help fulfill those needs. At this time, many of our long-term care facilities are still accepting new patients. There are guidelines put in place for the acceptance of those new patients to help protect others that reside in those long-term care facilities and to protect the staff members there. But long-term care facilities are vital to any community. We are very fortunate to have them. And yes, we do still have long-term care facilities that are accepting patients.
Okay, thank you.
Yep.
That is my last question.
Yep. Thank you, Travis.
It looks like that's all the questions from the remote media professionals that we have on the line, so it will conclude our press conference for today. Our next press conference is scheduled for Monday, April 27th. I would just like to briefly summarize the Linn County metrics to date that Heather shared. Linn County currently has 507 cases, 33 deaths, and 241 individuals have recovered. As a reminder, please practice physical distancing, stay home when you're sick, and wash your hands often. Thank you.